contents. So you have the Nasogastric Tube, peak flow meter, pulse oximeter, pulse oximetry, nebulizer, Ambu Bag, lumbar puncture, urinary catheterization, endotracheal intubation, peritoneal dialysis, and IV cannula. So this is the nasogastric tube. So indications of uses: feeding or administration of medications, suction, gastric decompression, gastric lavage. Patient position: semi-fowlers, position posture, sitting, straight, upright, knees bent. Otherwise, supine. Gather equipments, proper hand washing and gloving. Measurement and marking the nasogastric tube is very important. You should measure as on the picture, like you can measure from the tip of the nose to the earlobe to the xiphisternum. So hold the chain, lubricate tip of the tube with water jelly, and then pass it directly through the nostril. Push it slowly in. After reaching the measured distance, fix the tube with tape on nose or face. Check the tube placement by aspirating some stomach contents or injecting air down the tube and listening over the abdomen. Coming to the complications. So traumatic bleeding in neonate, tube into the lungs, aspiration following feeding, damage to the ciliary epithelium, more infection, long-term use. Rare complications include esophageal perforation, brain injury, etc. Contraindications. We have the absolute contraindications and relative contraindications. That is absolute contraindications. We have coagulation abnormality, esophageal varices or stricture, recent banding of esophageal varices. So coming, this is a peak flow meter. So this is, if you can see the picture, you have three measurements here. You have the measuring scale, you have the indicator, and a mouthpiece. So uses. Peak flow meter can be used to classify severity of asthma, to see whether the management plan is working or not, to decide when to add or stop medicine, and peak flow meter is not usually applicable for less than 5 years of age. It has to be used only above 5 years of age. Coming to the procedure, place the indicator at the base of the numbered scale, position, stand up or sit in the upright posture, take a deep breath, place the meter in mouth and close lips around the mouthpiece. Do not put tongue in hole and do not put finger over measuring scale. Blow out as hard, as fast as can. Write down the number you get. Repeat the steps 2 or more times. Note the highest reading. Coming to this is the nebulizer. So these are all the parts of the nebulizer. So the purpose of nebulization is to administer various drugs to the airways like bronchodilators, which is mostly used, steroids, etc. To hydrate thick sputum and prevent mucus plugging. To add moisture to oxygen delivery system. Coming to the parts of nebulizer. So you have the main compressor you have. This is the filter, air outlet and air tube. So you can see the nebulizer cup or mixing chamber, mouthpiece or T-piece, and you have mask, big mask and a small mask. So procedure, clean all parts before use. At first, attach the air tube to the outlet of the machine, fill air tube with mixing chamber and mask. Take measured amount of drugs into the mixing chamber by syringe or dropper and mix with normal saline. Connect the electrical line and turn on the switch. Look whether fine mist is coming out through the mask adequately. Place in comfortable position, that is head upright. Put the mask to the face of the chair, covering nose and mouth adequately, but not very tight. In case of mouthpiece, place it between patient's lips into oral cavity. Continue nebulization until fine mist is no longer present. So you have to do it as long as there is no mist. Clean the machine after every use. And this is the pulse oximeter, which is widely used now due to corona patients. Almost every house has got these pulse oximeters. You have a desktop and a finger pulse oximeter. So this is a device. This is used to determine the percentage of hemoglobin saturated with oxygen. So the oxygen saturation, that SpO2, is a measure of how much oxygen the blood is carrying as a percentage of the maximum it could carry. The heart rate. The heart rate refers to the number of times the heart contracts in a period of 1 minute. See, this is, I showed you the two types of pulse oximeter, the desktop and the finger. So this is the device used to measure the blood and heart rate. You can check the SpO2 and pulse rate. Here you have 97 and 72. So this is a normal thing. So through infra light or red light, so you have that photo detectors is there. The sensor detect how much oxygen is in your blood based by the way infrared and red light process through your finger. So you can get hypoxia, that is too little oxygen to fulfill the needs of the brain and body. For a patient shows signs of becoming cyanotic. In the ICU, pulse oximetry is used extensively on mechanically ventilated patients, as it can frequently detect problems with the oxygenation before they are noticed clinically, as well as a valuable guide for weaning patients off ventilation and helping to access the adequacy of a patient's oxygen therapy. So coming to this, I think you all know this. This is the Ambu Bag. So this is artificial manual breathing unit. So parts, you have the Ambu bag proper, that is the ventilation bag. You have the mouthpiece or the mask. You have the oxygen connector tube. You have the oxygen reservoir, and you have the pressure limiting valve, that's pop-up valve. So indications, you can use in the neonatal resuscitation in case of perinatal asphyxia, respiratory distress syndrome, respiratory failure due to any causes like pneumonia, severe acute asthma, poisoning, GBS, etc. Contraindications, diaphragmatic hernia and tracheoesophageal fistula. So you have this expired area of 16% oxygen, Ambu bag, that is room air to 12% oxygen, Ambu bag plus oxygen 10 to 15 liters, that is 45% oxygen, Ambu oxygen plus reservoir bag, you have 85% oxygen. So this is the sniffing position, is very important. See, thumb and index finger to maintain face seal. So the face seal to maintain the thumb and the index. So the middle finger you have you have to put it under the mandibular symphysis, and coming to the ring and little finger under the angle of mandible. So this is the way you have to put your hand. Coming to this urinary catheterization, so indications of urinary catheterizations, like you have the diagnostic and therapeutic. So diagnostic, you have this collection of uncontaminated urine specimen for accurate measurement and monitoring of urinary output for urodynamic studies. Therapeutic, to relieve urinary retention, for bladder irrigation, intermittent decompression, neurogenic bladder, to empty the bladder before, during, or after surgery. Intravesical chemotherapy. There are types of urinary catheter. There are different types of urinary catheter. One is the straight catheter, is used when the catheter is to be used for very temporary cause. Coming to the indwelling catheter, this is also known as the Foley's catheter, is left inside the bladder to provide continuous urine drainage. The other one is the suprapubic catheter. This is a type of indwelling catheter. It is inserted into the bladder through a surgical incision made in the abdominal wall right above the pubic symphysis. Coming to the condom catheter, is used for continuous collection of urine when there is no need for catheter insertion. Three-way catheter for continuous bladder irrigation is a type of indwelling catheter. It is inserted to irrigate the bladder to prevent obstruction, bleeding. So there are all the typical weights and tube sizes for ages. So all different ages, weights, and Foley's, like these are all the different sizes. So I don't have much time. I cannot go in details. Coming to the equipments, you have the catheter tray with the drapes, fenestrated drape, cotton balls, forceps. Catheter, this is the appropriate size, sterile drainage, tubing with collection bag, correct size syringe, check catheter balloon, sterile water, cleansing solution like Povisep, lubricant, sterile gloves, specimen container, and tape to anchor tubing. So this is the procedures. You have the issue to the child, maintain adequate lighting, So position like coming to the female child, put her in dorsal recumbent, that is supine with knees bent and hips flexed. Okay. Coming to male child, supine position. If soiling evident, clean genital area with soap and water first. Perform hand hygiene. Assemble all the equipments. Coming to the open the sterile catheterization kit using sterile technique. Put on the sterile gloves. Apply sterile drapes. Place a fenestrated drape, that is female child over perineum, male child over penis. Lubricate the catheter. Pour the antiseptic solution over the portholes. Place the urine specimen collection container within easy reach. So cleans meatus, that is female child, using swabs held in forceps. In the other hand, clean the labia, folds, and urethral meatus. Move swab from above the urethral meatus down towards the rectum. Discard swab after each urethral stroke. Male child, retract foreskin if not circumcised. Hold penis below glans. Using other hand, clean the meatus with swabs held in forceps. Use a circular motion from the meatus to the base of the penis. For older boys, insert the xylocaine gel into the urethra, H holding the penis perpendicularly, and wait for 2 to 5 minutes before proceeding to the next step. Insert catheter until urine flows. Advance 2.5 to 5 centimeters more. Then inflate the balloon with distilled water. Gently pull catheter until resistance is felt. Connect catheter to drainage system. Secure the catheter to thigh. Position drainage bag lower than the bladder. Dispose the gloves and other disposable articles. Perform hand hygiene. Documentation of the procedure. So coming to this lumbar puncture needle. So indications of lumbar puncture you all know: encephalitis, GPS. So meningitis, all types of meningitis like bacterial, viral, tuberculous meningitis, systemic diseases like SLE and multiple sclerosis, subarachnoid hemorrhage. Coming to the therapeutic, intrathecal chemotherapy in leukemia, spinal anesthesia, CSF in benign intracranial hypertension. Coming to the contraindications, you have raised intracranial pressure, localized skin infections, bleeding disorders, example, hemophilia. So lumbar puncture needle having trocar with knob and cannula. So site usually done in third or fourth intervertebral space, that is between L3 and L4 or L4 and L5 vertebra. Coming to the procedure, written informed consent. Patient sorry, patient should be lying on his or her side on a firm table bed with knees and chin as nearly opposed as possible. Restrained position. I think you can see the position there. Back of the patient should be right at the edge of the table. Its transverse axis, that is a line passing through the posterior superior iliac spine, should be vertical. An expert assistant is needed to hold the patient in position comfortably. After positioning, site of lumbar puncture is identified by fourth lumbar vertebra, which is in the same plane with iliac crest. Physicians must wear mask, gown, and gloves. After putting the skin wash draping, LP is done with all aseptic precautions by putting thumb of hand on the spine and introducing the needle by right hand firmly through the skin in the midline between spines. Direction of the needle should be forward and slightly towards the head. As the dura is spiced, there is a sense of pressure, release, and as the needle enters the subarachnoid space, CSF comes out. After collecting essential amount of fluid, LP needle is withdrawn and a sterile dressing is applied. Patient should lie flat for 8 to 12 hours without pillow and should be given drink immediately after manure. So usually CSF is collected in 4 pre-numbered tube to be used as following. Tube 1 should be reserved for non-routine studies. Tube 2 can be used for immunology and chemistry testing. Tube 3 can be used for microbiology testing. Hematology analysis is typically performed on the last tube, collected 3 or 4 to ensure that any peripheral blood that may have contaminated the sample during the lumbar puncture has cleared. When only 3 tubes are obtained, Tube 2 is often reserved for microbiology, and Tube 3 is shared with the hematology testing performing first, followed by any chemistry or immunology testing. What should be seen in CSF? See, these are all the things we have to check in CSF, like pressure, physical character, that is the color, biochemistry, you should look for protein, sugar and chlorides, cytology, you should look for cell count, differential count, microbiology, you should look for gram stain, culture and sensitivity, AFD. Serology, you should look for viral serology, VDRL, cryptococcus, etc. Complications, you have this headache, local pain, bleeding, herniation of brainstem, persistent CSF leaking, injury to local structures like intervertebral disc, vessels, nerves, etc., infections causing meningitis, etc. So this is the endotracheal tube. Uh, so the intubation, so we'll be discussing about the endotracheal intubation. That is to provide mechanical respiratory support, obtain respirates for culture, assist in bronchopulmonary hygiene, that is pulmonary toilet, elevate subglottic stenosis, endotracheal medications like epinephrine, lidocaine, atropine, etc. So the instruments we use here is the ET tube with or without cuff, laryngoscope with blade, suction apparatus, bag and mask with adjustable oxygen source, cardiorespiratory monitor. These are all the instruments we used while doing endotracheal intubation. So these endotracheal tubes can be cuffed or uncuffed. Cuffed ET tubes are usually used in children more than 8 years. The cuff, when inflated, maintains the ET tube in proper position and prevent aspiration of contents from gastrointestinal tract into the respiratory tract. In children less than 8 years, uncuffed ET tubes are usually used because the narrow subglottic area performs the function of a cuff and prevents the ET tube from slipping. So these are all the two types. So this is YouTube. So here you can clearly see that blue color cuff is there. So that is the Murphy's eye. This is the tracheal tube. You have the connector stellate is there. Okay, and this is the uncuffed ET tube. So these are all the various sizes of ET tube. So neonates like the gestational week less than 28, like based on the weight. So we can 2.5 to 4.0 millimeters size. Okay. So age more than 1 year, you can go for more than four. So these are all the two types of. This is the laryngoscope actually. Like see, you have this bulb here, you have the blade here, so you have the handle. Okay. So this is Macintosh and this is the Miller. Different types of blades. Assembly and preparing all equipment. So preparing the patient, like position, that sniff position, roll tower under shoulder or supine, do not hyperextend. Suctioning, oropharynx and nasopharynx as needed. Pre-oxygenation with high flow oxygen for minute if possible. Do not bag if meconium aspiration or in case of diaphragmatic hernia. Monitoring vital signs and oxygen saturation.